All in all, AmVisc Plus with cohesive versatility allows the cataract surgeon to efficiently perform the procedure without the need to add a second viscoelastic. In order to understand what makes AmVisc Plus cohesively versatile, we must first understand viscoelastics in general. First, it's important to know that even though most viscoelastics contain the same basic active ingredient, sodium hyaluronate, they certainly do not all perform in the same way. The Xioptics Diagnostic Workstation combines the OrbScan 2Z anterior segment analysis system and the XiWave 2 wavefront aberrometer into one workspace. This means that the user is able to operate both systems comfortably without having to change places. The XiWave 2 wavefront aberrometer works by focusing a single laser light point on the retina and then analyzes how that light is returned from the eye. The outgoing light rays are passed through an array of tiny lenses. This wavefront is captured by a CCD chip. The difference from the ideal plane wavefront is measured, and the wavefront aberrations are then displayed. The Xilinc customized treatment calculation software, along with input from the refractive surgeon, generates an individual treatment file for the patient, known as a TLS file, which is used to guide the Bausch & Lomb Technolas 217Z Xioptics excimer laser system. The combination of all of these state-of-the-art components creates the Xioptics system for personalized vision correction, a reliable partner in any clinic or practice. The purpose of this video presentation is to provide you with visual guidelines on both the preparation and reconstitution of the study medications, as well as a demonstration of the intravitreal injection. We thank you for your adherence to these guidelines and look forward to your successful participation in this clinical study.
Insulin users of all ages are now able to perform insulin injections anytime, anywhere. Regardless of lifestyle, the Innova provides convenience, freedom, and most importantly, the sense of security that insulin users require, getting rid of their syringes once and for all.
To show the impact chain length has on viscoelastic performance, long, medium, and short chain viscoelastics were compared and evaluated by the use of Miyake reverse view and overhead camera. Helon and Provisc served as the long chain models, AmVisc Plus the medium chain model, and Viscoat the short chain model. Porcine eyes stained with fluorescein dye were utilized in this randomized test to evaluate cohesive variation between AmVisc Plus and the aforementioned viscoelastics during phaco, lens insertion, and aspiration. As can be seen in this time-lapse sequence, the short-chain viscoelastic, Viscoat, demonstrated the effect of minimal cohesion. It stayed in the chamber throughout the entire phaco operation. However, after lens insertion, aspiration was still not complete after 2 minutes. In another test, the highly cohesive long-chain viscoelastic Helon was tested. Within 10 seconds of implementing phaco, the Helon had completely been evacuated from the chamber. The lensectomy was performed without any viscoelastic in the chamber for a full minute. Helon was reintroduced, and following lens insertion, aspiration was accomplished in approximately 30 seconds. The highly cohesive long-chain viscoelastic Provisc was tested as well. It demonstrated characteristics similar to that of Helon. The medium-chain viscoelastic AmVisc Plus with cohesive versatility was then tested. Like the short-chain viscoelastic, it remained in the chamber for the entire phaco procedure. During aspiration, however, AmVisc behaved more like the long-chain viscoelastics, achieving total cleanup in approximately 1 minute. Looking at these time-lapse sequences side by side, AmVisc Plus and Viscoat stayed in the chamber throughout phacoemulsification. Helon and Provisc, however, were completely aspirated within 10 to 25 seconds. The long-chain viscoelastics, Helon and Provisc, were easiest to aspirate, while the short-chain viscoelastic, Viscoat, could not be totally aspirated even after 130 seconds. Amvisc Plus, the medium chain viscoelastic with cohesive versatility, was completely removed, requiring a slightly longer aspiration time than Helon. The Easy Load lens delivery system, which folds and delivers the Softport 3-piece advanced optics aspheric intraocular lens LI61AO or LI61AOV with violet shield technology. The Easy Load lens delivery system consists of a syringe-shaped body and tip with a plunger, drawer, and haptic puller. Combined with the lens case, the system provides fixture loading with no lens contact. Additionally, the Easy Load lens delivery system has been designed with a small tubular pathway, allowing for lens placement into the eye with one continuous forward motion.
The TSV-25 system utilizes the unique microsurgical entry site alignment cannulas. The 25-gauge Lightning high-speed cutter, the only electric cutter available, delivering 1,500 non-pulsating smooth controlled cuts per minute. And a high-output true white light dual-port mercury vapor illumination light source.
Simplicity, versatility, Encore. In an endeavor to support physicians' efforts to diagnose breast disease, Cenerex has developed the Encore vacuum-assisted breast biopsy system. Encore's elegance is centered on its simplicity and versatility, and is compatible with all three imaging modalities: ultrasound, stereotactic, and MRI. Along with state-of-the-art functionality, the Cenerex Encore MRI system meets the interventional demands of the breast care physician in the MRI environment. The Presby lens that can simply and elegantly renew vision by reshaping the cornea, the principal component responsible for the majority of the eye's focusing power, and allowing it to work with the eye's presbyopic clear crystalline lens. Present the Acreos single-use insertion device, which folds and delivers the Bausch & Lomb one-piece Acreos advanced optics aspheric lens into the eye. The Bausch & Lomb Acreos system, innovative design and outstanding optics, delivering greater surgical efficiencies for cataract surgeons and their patients. This hourglass-shaped circular coil, in addition to its radial force, allows the stent to conform to the natural shape of the prostatic urethra, not only enhancing patient comfort, but preventing the stent from migrating. And by flushing the stent with cold irrigation solution between 10 to 20 degrees centigrade, the Horizon stent becomes soft and pliable, allowing it to be easily removed if need be. The Softport system. The Softport system is comprised of the Soflex Li61SE foldable square-edge multi-piece intraocular lens and the M-Port SI MP28 injector, along with Amvisc Plus, the viscoelastic with cohesive versatility, and laser-edge disposable surgical blades for precise wound construction. The Softport system is now the surgical choice for atraumatic IOL delivery and implantation. Has a power-locking spring system which engages the slide, allowing it to snap open or closed. A unique advantage of the bracket is that both the upper and lower slides open away from the clinician, providing the clinician with a full and clear view into the archwire slot. With a simple plunging motion, the Soflex lens glides down the M-Port SI MP28 injector's tapered tip, allowing the lens to slowly blossom out in a safe and controlled manner with no haptic sweep. The unique M-fold of the Soflex Li61SE assures safe unfolding of the lens on one plane into the bag.